Hi, I'm Dr. Gawel from Indian Trail Animal Hospital. Today we're going to talk about emergency care in your dog. So what exactly is an emergency? Well, let's start with the basics. A definition of an emergency is a very serious, unexpected situation that requires immediate attention. So what exactly might be those signs and symptoms that our dog is experiencing an emergency that requires those immediate actions? Well, we can see anything from where we lose function of our legs, so a paralysis, difficulty standing, or even loss of consciousness. Seizures are always deemed an emergency. Broken bones. If your dog's belly looks very firm and distended and bloated, also could be deemed as an emergency. External wounds that are bleeding. That could be from a dog fight or bite, another animal bite, hit by a car, or another type of blunt force trauma. That is deemed an emergency. If in a very short time period we're seeing excessive diarrhea and vomiting, and those signs have led to blood in the stool or vomit, that could be deemed an emergency. Pale gums, difficulty breathing, increased or rapid breathing can be an emergency. You may also want to look at your pet's gums to see if they look blue, purple, or very dark. Some of the other emergencies that we don't think about because they don't have an immediate reaction right away, but things like insect stings, snake bites, spider bites, as well as certain toxin and medication exposure can also be deemed an emergency. So most emergencies are going to occur within a very acute time period. What does that mean? Within 24 hours to sometimes within the hour, your dog is going to be healthy and happy and then change to being very sick and very ill. The best recommendation we can give in any one of these scenarios is to call Indian Trail Animal Hospital as soon as possible. There are many reasons for trying to make this phone call prior to coming into our office. We may be able to give you advice for first aid or what to do at home. If you're on your way, we can prepare for that emergency. So we are getting certain medications, oxygen, emergency drugs, stabilizing procedures such as IV catheters and fluids, and we'll be prepared for when your dog comes to our doorstep. Prompt treatment in an emergency is crucial. We want to be able to stabilize your dog as soon as possible or reverse those effects of shock so that we don't see the further negative and complications of these problems. It's important to stabilize and safely transport your dog to our office. You may use something like a board for a stretcher or any type of hard, flat plastic that they can be used on a stretcher to transport. If you're able to carry your dog, I would recommend bigger, fluffier blankets to wrap them. Be mindful of any external wounds. Towels, blankets can be used to apply direct pressure to these areas. While you don't need to splint broken bones or injured extremities, it is always best to use multiple layers of padding around these areas to stabilize so there is little to no movement of these extremities. Lastly, it's good practice to be cautious around your pet during an emergency. When a dog is in pain, unfortunately, it may express itself by biting. Using a muzzle when preparing for transport and getting your pet into the vehicle is important. If you don't have access to a muzzle, wrapping that pet around the neck with a towel like a scarf or placing extra padding around the head and face will help prevent an injury to you and to him. If you have any questions regarding a dog emergency, please contact us. We're always here for you.